Welcome back. So glad to have you guys. We're going to discuss today oral health and cancer therapy. If you're undergoing cancer therapy, I wish you the best. I'll put you under my umbrella of prayer. This goes out to my friend April, who wanted me to do a YouTube video about oral care and cancer therapy. And God bless you, April. My name is Becky Moore. I'm with Restart Hygiene. I love teeth and gums. And I come on today to spend time with you to help educate you on how you can be healthier if you are undergoing this treatment right now. And I know you're going to be fine. Keep fighting the fight, and God bless. So let's get started with how to help you. Okay, so we want to make sure that you do all the things you can do to stay as healthy as you can. And hopefully you feel like doing a couple of these each day so that you can minimize your cavities, minimize your gum disease, which are both side effects of chemotherapy and radiation. All right, so we're going to talk about cancer therapy on the teeth and gums, the effects, and some ways to minimize it, including some holistic ways. I love to do things as holistically as I can so that there's less gum disease and cavities, and that's really important to me to share that with you. All right, so understanding cancer therapy on your teeth and gums. Chemotherapy and radiation affect your saliva flow. They affect the vitamins in your body and the nutrients that you're able to use. So we want to make sure that you are able to use everything that you put in for good for you to help you to be strong. We know that if you don't get enough nutrients, your guts are not going to be able to make you as healthy as you can. So your immune system is very important this time. So getting the proper nutrients can help you as well. Whenever you have changes to your tissues in your mouth, so if you have radiation in your head or neck area, this can be very damaging to those tissues. So we want to make sure that your mouth stays as hydrated as you can, your saliva flow stays good, you're able to eat good foods, and you're able to maintain if you get any sores or areas in your mouth that would be tender or painful. So if we don't take care and make sure that we have enough saliva flow during this time, that can be the main culprit, and if we don't, it can be disastrous for cavities and bone gum disease. Okay. All right, so we want to talk about if you have sores or irritations. Sometimes you wear dentures and the sores get in your mouth, especially during cancer time, cancer therapy, that can be really harmful and hurtful because you have to wear your teeth to eat. So we want to make sure we clean our sores well. Warm salt water rinses are a really good way, old-fashioned way of doing that. A teaspoon of salt to half a cup of really warm water 2 to 3 times a day can help you. Putting some coconut oil in your mouth, swishing around your mouth. So even if you don't have any teeth, so if you're dentureless, putting some coconut oil in your mouth with or without teeth can certainly lubricate your tissues, can be very antibacterial and antifungal, and that certainly will help you improve that. You can even brush a sore very gently with a toothbrush because keeping your mouth clean as you can during the sores and irritations can help it to heal. I love peroxide. If you can isolate peroxide to a sore and just clean that area with peroxide a couple times a day, you will see that sore really improve very fast. So I would recommend that as well. So know that your mouth heals the fastest when it's kept clean. This is for any sore condition, but especially during cancer therapy. So that should help you. Okay, so oral health regimen. What do I recommend if you are undergoing cancer therapy? Of course, as a dental hygienist, I'm going to recommend that you brush your teeth twice a day, two times for a full 2 minutes. I do recommend you use a product that can help soothe your tissues and help decrease bacteria and keep your saliva flow as healthy as you can. That's why I love the Spry brand. This has fluoride, which is a mineral. It has xylitol, which is a sugar alcohol. So if we all know fluoride, let's start there. Fluoride prevents cavities. It's a mineral that strengthens enamel on your teeth, which is good. Xylitol is a sugar alcohol that decreases the bacteria in your mouth, so the bacteria can't grow once they ingest the xylitol. Aloe is naturally occurring, and it will help to lubricate your tissues. There's a new ingredient, L-arginine, in this. This helps to bring your pH levels up. Anytime in your mouth your pH levels go down, think of battery acid. So if your pH levels are below 6 or 7, they're in an acidic state. Anytime there's an acidic state, like acid erosion, that's when the bacteria can start eating holes in whatever it's on. So it can eat a hole in your enamel, it can eat a hole in the root of your tooth, which is the cementum and the dentin inside your tooth. So we want to make sure that the acids stay at a minimum. So we want us to keep a pH level that's neutral. So brushing your teeth with this product and brushing your teeth period can help keep your teeth healthier, bacteria less bacteria, less acids, less cavities, less gum disease, which is good. Very important. Use a non-alcohol mouth rinse or mouthwash. Alcohol dries out your mouth, whether you're drinking it, whether you're swishing with it. So make sure you get a non-alcoholic mouthwash to use, and you can use that daily. Now it depends on what you're using it for. Do you want to kill bacteria, or do you want to do you want to strengthen your enamel? That would be an anti-cavity, would be to strengthen your enamel, or a fluoride type rinse. Anti-gingivitis would be something that you would want to use if you're trying to help keep your gums healthy. So remember that and be very careful, because when you go to the store, there is a mirage of mouthwashes, and it makes it really, really hard for you to find the one that you're looking for. I'm a big fan, of course, of flossing. Water picking is another one of my faves these days. Water picking can remove a lot of bacteria. It can remove acids. It can disturb that. It can help to clean your teeth. It can help to toughen up your gums. So that's very important right now. The little saw picks are very handy. They're very helpful to use. I also love my rubber tip. This is an oldie and goldie, but these rubber tips can be run right along the gum line, and they can help to disturb bacteria, food debris that's there. They're easy to use. You can keep them by your chair, so if you're not feeling like getting up and going to the bathroom, just run that rubber tip along the gum line. Stimudents. Patient was talking about Stimudents this week. Stimudents are really helpful. They sent him off in the military when I think he was in the Army or the Marine Corps, and the government gave him Stimudents to use. And those are just the little toothpick type things, but they would clean between their teeth with them, so that was really helpful too. So make sure you're doing that. Some holistic ways to help to keep yourself clean and healthy, it would be to use, of course, the xylitol, because it is naturally occurring in nature. I love the toothpaste. I also love the chewing gum and the mints with the xylitol in them, as well as the mouth spray. So the mouth spray is awesome as well. So if you use these products, they can increase your saliva flow. The xylitol helps decrease the bacteria, and that's helpful in helping to keep your teeth healthy and strong. Avoid alcohol and caffeine. These are drying effects on your mouth as well. So if you're drinking alcoholic beverages, remember you want to swish with some water or drink water behind them, and that'll help to minimize the drying effect as well. Try freezing a cucumber or melon and then just sucking on it. That's a great way to moisturize your mouth, especially when it's hot in the summertime. So that can be a good way and offering to do that as well. Use it as a lozenge. The spray that I showed you, the X-Clear is a good one to use as well. It increases your saliva flow. Saliva flow, maintaining that, like we said in the beginning, is so very important and will help to freshen your breath. And even Johns Hopkins Hospital recommends, as a dry mouth remedy, to do acupuncture. So I thought that was very interesting. So that's something you may want to look into as well. Okay, so now you're in cancer therapy. You know you're supposed to brush and floss and water picking, all those good things, and you know what products you're going to use. So let's talk about nutrition. Nutrition is important at every stage in our life, but it's especially important when we're undergoing something where our immune system is at risk, is being vulnerable. So we want to make sure that you're getting nutrient-rich foods, which can help your body to rebuild and to help overcome the cancer diagnosis. Likely you're probably going to be eating some soft foods, which is just fine. We can eat soft foods and maintain from that for a while. We want to make good choices. So I wanted to give you a list of food choices to think about if you are ingesting soft foods that can really be beneficial. Applesauce, mashed bananas, watermelon, even fruit smoothies are good for you. Scrambled eggs and boiled eggs, they have lots of protein. Hearty soups with lots of vegetables. Milkshakes, which we love. Avocados are really good for you if you like avocados, because they can be kept cold. That's something cold in your mouth too. Sweet potatoes are really good. Yogurt, oatmeal, fish is a really, really good one. Pastas are also good for you as well to get some nutrients in, some energy. Even softer meat. So if you want to eat meats, put them in sauces or gravies, and that can help to make them easier digestible, easier palatable if you're trying to get them in. Keep in mind to drink plenty of water all day, every day. Drinking water can be so beneficial to you. Be careful if you're drinking flavored waters, though, or anything that might have sugar or acids in them. That usually can land under the radar, and that can harm us if we're not careful, so be mindful of that. And then take a full coverage multivitamin. If you're thinking you're not getting all of your vitamins, this is one that I like to use. It is one you have to swallow. But it also just helps you, gives you that extra benefit of making sure you're getting the vitamins that you need every day. And that will increase your gut health, which will make your immune system stronger. So know that as well. I cannot say enough to hydrate. So water is great. Another good option is to have a humidifier in your room. Wherever you're at most of the day, a humidifier can moisten the air. That helps moisten your nasal passages. That helps moisten your mouth. And that can be very helpful in keeping you healthier and stronger. So know that as well. And just watch any sugars, any acids because of the cavity formation. That we want to make sure that you're able to do that, especially if your saliva flow is lessened. Know that medications that you may be taking as well, if you're not undergoing a certain if you're not undergoing radiation, but you're taking a chemotherapy pill, this can still affect you and dry your mouth out. And any other medications that you take, blood pressure and other medications, do dry your mouth out. Even antihistamine and ibuprofen can dry your mouth out. Reduce as much sugar as you can. You guys probably have already researched and know that sugar inflames the body, and cancer is inflammation in the body. So we want to make sure that we reduce our sugars as much as we can. I'm not a big fan of using artificial sweeteners either. That's why I love xylitol, because it's a real sugar. It's a sugar alcohol, but it doesn't cause cavities. And the studies say that it doesn't increase your risk for driving your blood sugar up if you're diabetic. So that could be a very good option. I like to use, in my coffee, I like to use erythritol. It's a sister of xylitol. And so it helps me as well. All right, so ways to encourage, if you're going to ingest sugar or acid, some ways to avoid your teeth being so exposed would be drink through a straw. Only ingest sugars or acid for 20 minutes at the top. So at 20 minutes, you want to stop ingesting and take a break and drink some water. Watch out for sugars and acids. We've talked about that. Swish with water if you're unable to brush. So if you get something to eat and you're on the run, at least take some water and swish that around. They do recommend, the American Dental Association recommends not brushing your teeth for 30 minutes after you eat. This is to help the saliva to coat your teeth and to remineralize your teeth. So that's really important to know as well. Swish with water after you're not able to brush, we said. Spray bottle. You can take a spray bottle and just spray water in your mouth. That helps to lubricate your tissues. So that's a good way to get it into, especially at night. And then we talked about waiting 30 minutes. So wait 30 minutes after you eat. All right. I hope something that I said today can help you, make you healthier when you're undergoing cancer therapy. Your body's going through so much. Staying as healthy as you can will help you to feel better and to hopefully heal your body and get you back to normal, which is what we want. And make sure you address your healthcare team. See your dentist during your cancer therapy. Every 6 months, I wouldn't wait any more than 6 months in between to make sure that nothing is changing. If there's any cavities that are forming, they can see those in advance. And just take good care of yourself so that you can minimize the effects of the cancer. You're going to get better. You're going to improve. You're going to get back to normal. And we want you to have bright, shiny, healthy teeth and gums when you do. So that's really important. If there's another topic you would like for us to discuss, please put it below. Please like and subscribe if anything that I said helped you with your journey. And I wish you many, many hugs and love to make sure that you are getting better and that you do improve your health and get back to normal. You have so much to live for, and I can't wait to hear some good stories from you. Have a good day.